Let me begin with a question that most men over 50 rarely say out loud, but quietly carry with them. What if one small, almost invisible habit could improve something as personal as your ejaculation health? Not a pill, not a complicated routine, not something extreme or uncomfortable, just one simple action, done consistently, that supports your body in the way it was designed to function. Because if you've noticed changes over the years, a weaker ejaculation, less control, longer recovery time, or even a subtle drop in satisfaction, you're not imagining it. And more importantly, you're not alone. Reassuring. In fact, in clinical practice, this is one of the most common concerns men experience after 50, yet it's rarely discussed openly. There's often a quiet assumption that this is just how things go with age. Size. That once these changes begin, they can't really be influenced. So many men either accept it, or they go searching for answers, only to find themselves overwhelmed by supplements, conflicting advice, and unrealistic promises. But here's the truth that often gets overlooked. Your body, even after 50, remains highly adaptable. It still responds, it still adjusts, it still improves, but it doesn't respond well to extremes. It responds best to simple, consistent habits, repeated over time. I'm Dr. John, and over the years I've worked with many men navigating these exact changes. Shifts in testosterone levels, reduced blood flow efficiency, prostate enlargement, and changes in nervous system sensitivity. And today, I want to share with you one habit that consistently stands out. It's simple, it's often overlooked, and it directly supports ejaculation quality in a very real, physiological way. That habit is regular pelvic muscle engagement, what many people refer to as Kegel exercises. Now, I know what some of you might be thinking. Isn't that something for women? And that's a very common misconception, because in reality, these muscles are just as important for men. And when you understand their role, it begins to make perfect sense. Let's slow this down for a moment. At the base of your pelvis, there is a group of muscles known as the pelvic floor. One of the key muscles in this group is the pubococcygeus muscle. This muscle plays a central role during ejaculation. It's responsible for the rhythmic contractions that help propel semen outward. It contributes to the force, it influences control, and it plays a role in the overall sensation. Now here's where aging comes into the picture. As men get older, these muscles, like any other muscle in the body, can gradually weaken, not because something is wrong, but simply because they are not being actively engaged or trained. And over time, that lack of engagement can lead to noticeable changes. You may begin to feel that ejaculation is less forceful. You may notice less control over timing, or you may simply feel that the overall experience is not as strong as it once was. These are not random changes. They are often the result of muscle function gradually declining. And the encouraging part is this. Muscle function can be improved, even after 50, even after 60. These muscles respond very well to training, often more quickly than people expect. Now let's talk about what actually happens when you begin this habit. The first benefit many men notice is improved ejaculation force. When the pelvic floor muscles are stronger, the contractions during ejaculation become more effective. Biologically, this means better propulsion. But beyond biology, there's also something psychological that happens. Many men report a restored sense of confidence, a feeling that their body is responding again, not perfectly, but better. And sometimes, that shift alone is meaningful. The second benefit is improved control. These muscles are involved in timing, and when you build both strength and awareness in this area, you gain more influence over your body's response. This doesn't mean complete control. That's not the goal. The goal is improvement. Even a small increase in control can change how a man experiences intimacy. The third benefit is something many don't expect: improved circulation. Every time you engage the pelvic muscles, you're stimulating blood flow to that region. And circulation plays a major role in tissue health. This includes the prostate, which, as many men know, can be affected by age-related changes such as enlargement. Now let's be clear, this is not a cure for prostate conditions. But it is a supportive habit, and when combined with other healthy behaviors, movement, proper sleep, balanced nutrition, it contributes to a healthier environment within the body. Now, let's talk about how to actually do this in a simple and practical way. The easiest way to identify the correct muscles is to imagine stopping the flow of urine. That subtle contraction you feel, that's your pelvic floor. But once you've identified it, you should not practice during urination. Instead, practice separately at any point during the day. You can be sitting, standing, or even lying down. Gently contract the muscle. Hold it for about 3 to 5 seconds. Then relax. And that relaxation part is just as important as the contraction. Repeat this process 10 to 15 times in one session, and aim for 1 to 2 sessions per day. That's all. No equipment, no visible effort, no disruption to your routine. And that's what makes this habit so powerful. It fits into your life, instead of requiring you to change your life. But like any habit, how you do it matters. Let's take a moment to talk about common mistakes. The first is overdoing it. Some men believe that stronger contraction equals better results, so they tense too hard or hold for too long. This can actually create unnecessary tension in the pelvic area, and instead of improving function, it can interfere with it. The goal here is controlled engagement, not strain. The second mistake is inconsistency. Doing the exercises for a few days, then forgetting for weeks, will not create meaningful change. This is not a quick fix. It's a quiet, steady process, and the body responds to repetition. The third mistake is expecting immediate results. In a world where many things feel instant, this requires patience. Most men begin to notice subtle improvements within 2 to 4 weeks. More noticeable changes often come after a couple of months, and those changes tend to build gradually. Now let's take a step back and look at the bigger picture. Ejaculation health after 50 is not controlled by one factor. It's part of a larger system. Hormones play a role. Blood flow plays a role. Sleep quality, stress levels, cardiovascular health, all of these influence how the body responds. This habit supports one important part of that system, muscle function. But it works best when it exists within a balanced lifestyle. If you're already taking care of your health, if you're staying active, if you're paying attention to what you eat and how you sleep, then adding this one habit can quietly enhance how everything works together. And there's something important I want you to keep in mind. You don't need to compare yourself to your younger years. Your body at 25 is different from your body at 55. That's natural, but different does not mean worse. It means it requires a different approach. A more thoughtful approach, a more consistent approach, and often a simpler approach. So here's the bottom line. If you're looking for one small, effective habit to support ejaculation health after 50, regular pelvic muscle engagement is one of the most reliable options available. It strengthens, it improves control, it supports circulation, and over time, it helps you reconnect with how your body feels and responds, not through pressure, not through unrealistic expectations, but through awareness and consistency. If this is new to you, start small, stay patient, and simply observe. Because often, the most meaningful improvements don't come from doing more. They come from doing the right things, regularly. I'm Dr. John, and this is one of those habits that may seem simple on the surface, but over time can make a quiet, meaningful difference. Thank you for staying with me until the end of today's video. The fact that you're paying attention to your health now already puts you ahead of many others. If you found this helpful, consider subscribing to the channel so I can continue guiding you through the topics many men over 50 are often too hesitant to ask about. And take a moment to watch the next video on your screen. It will help you go even deeper into protecting your health the right way, backed by real science.